A pleasant day to you, dear viewers. I am Simplicio E. Rodriguez Jr. from Group 1 of Section 9, and I am proud to present to you our research entitled A Study of Nurses' Insights of Their Experiences with Overcrowding in Selected Hospitals in Metro Manila. In an overcrowded hospital setting, patients obviously are plunged into an unfavorable environment. As a consequence, the quality of care that they receive is undoubtedly affected. What then, in this situation, are the nurses' experiences? More importantly, what do they feel? Let us first briefly define overcrowding. According to Farflex, it is a state of being filled with more people or things than is desirable or congestion. Cameron stated that an overcrowded hospital should now be regarded as an unsafe hospital. For our study, we used none other than Florence Nightingale environmental theory. The environment plays a vital role in promoting the health and recovery of hospitalized patients. However, in an overcrowded hospital setting, the environment is not favorable to the patient's health and put a risk to the patient's safety. This model is therefore used to give stress to the role of good environment to the patient care. It shows that overcrowding therefore must be managed in hospital setting. The main objective of our study is to know the experience of the nurses who have worked in overcrowded public and private hospitals. We have identified the profile of our informants, as well as the effects of overcrowding to their performance. We have also discovered advantages of experiencing overcrowding as perceived by the nurses and have taken note of their suggestions about the situation. Our informants for this study are nurses who are working in private and public hospitals. After identifying them, informed consent was given and interviews were done through phone, through questionnaires sent via email, or through face-to-face meetings. During the course of our data gathering, we asked the informants if overcrowding affected them, and we categorized their answers. Among the physical effects are exhaustion, weight loss, and lack of sleep. Many have suffered emotionally, like feeling inefficient. Others share that they have less time for socialization. And lastly, some have experienced job-related changes like poor patient rapport. Based on the results, we conclude that overcrowded has negative effects on our informants. These are the effects of overcrowding to our informants based on the data we have gathered. Some have encountered angry patients, while others conversely have experienced getting angry at their patients. Many have dealt with exhaustion, confusion, and medication errors. And last but not the least, others have talked about having poor patient rapport. With the promise of confidentiality, we have asked the informants to share us their notable experiences while working in an overcrowded area. Here are only some of their stories and what they have to say about them. Despite its negative effects, it is surprising that our informants were able to enumerate some of overcrowding's advantages. They have identified this as having the ability to work under pressure, mastering time management, development of critical thinking skills, acquiring knowledge, and last but not the least, having patience. To further elaborate these advantages, here are what the nurses had to say. The nurses have several suggestions to the hospital to avoid overcrowding. Among these are providing adequate supplies, increasing space, improving facilities, and increasing manpower. Through this study, the researchers concluded that in order to solve the problem of hospital overcrowding, several factors have to be considered like the country's economy and healthcare delivery system, the nurses' quality of education, and the fact that Filipino nurses are going abroad. We have also noted that despite the situation, some nurses, like our informants, are still motivated to go to work. Surprisingly, they are able to see the good in hospital overcrowding. There are lots of studies about nursing and other hospital-related problems. However, we believe that our study is special in its own way, for it proves not only the ill effects of overcrowding as perceived by the nurses, but the advantages they see in a very unlikely situation. Let us not put aside the nurses' sentiments. Let us be an advocate not only to the patients who are suffering from overcrowding, but to our fellow nurses as well, who are sacrificing more than they could give. Please support our group. God bless you all. Simplicio E. Rodriguez Jr. out.